Good afternoon, everyone. Thank you for joining us. We're just going to wait a few minutes before we begin while we wait for everyone to join us. Then we'll do some housekeeping, but we'll just give it a minute or so. Good afternoon, everyone. We've got a few more people still yet to join us. So while we're waiting, I will just go over some of the features of the GoTo webinar. You'll be able to add questions to our guests using the little chat box down the side of your screen. You can post questions at any time and they can be answered during the question and answer section of our webinar, which will be towards the end. This webinar is being recorded and we'll be making a copy available to everyone in the week after the event. Your mics and cameras will remain off, but please feel free to pop your questions in the chat. We really like to have interactive. So this afternoon, I would like to now introduce Dr. Rebecca Goodhue. She's the RACE's lead for capacity building and will be hosting this webinar.
Thanks, Liz, and thank you everyone for joining us today. I'd like to begin by acknowledging the traditional custodians of the land on which my feet are placed. For me, that's the Ngunnawal and Ngambri people here in Canberra. I pay my deep respects to elders past, present and emerging, and warmly welcome all Aboriginal and Torres Strait Islander people here. Today we're going to look at how the Northern Territory and the Tasmanian Governments are using the Nest Wellbeing framework as the basis for their wellbeing data platforms. The jurisdictional experts who are going to talk to us about this are Cindy Jarvis from the NT and Antony from Tassie. We're going to start with the top end, a presentation about the story of our children and young people in the Northern Territory. The story, as it's referred to, presents comprehensive data on the Territory's children and young people. So I'd like to welcome Cindy Jarvis. Cindy is the Senior Director of Social Policy with the Department of the Chief Minister and Cabinet in the Northern Territory. Welcome, Cindy.
Thank you. I'd just like to start today by also acknowledging the traditional owners on the land on which I'm meeting, which is the beautiful Larrakia country up here in the top end, and pay my respects to elders past, present and emerging. And thank you very much for asking the Northern Territory to present today. The story of our children and young people is a project that we're very proud of and very, very happy to talk to you about it, to talk about the link that we have to a RACE and how this piece of work came about. Just moving that around. Oh, you have to bear with me. Technology is definitely not a strength of mine. My mouse is doing all kinds of crazy things. Here we go. So what is the story? So in 2016, at a change of government, and very timely at that point of time in the Northern Territory, the new government decided that they wanted to have a greater focus on children and young people, and in order to do this, they were developing an early childhood plan. So the early childhood plan was overseen by an expert reference panel of academics, Aboriginal leaders and people who were able to speak on behalf of children and young people in the Territory And a key recommendation throughout the development of the early childhood plan was that we needed to be able to measure our progress over time, and in order to do so, and looking at other jurisdictions, the recommendation was that the NT should develop its own State of the Children report. So early consultations that we had with the sector, early childhood sector, was that there was a preference for telling a story rather than it being labelled as another government report. The story was developed in partnership with Menzies School of Health Research, which is an affiliation with the Charles Darwin University, and it was overseen by an independent editorial committee. And we're very targeted in who was a part of the independent editorial committee. We had past members from the expert reference panel, as well as Aboriginal leaders. And so just setting the scene for us at that point in time, so this was around late 2018, moving into 2019. And we were in the background, there were 2 Royal Commissions going that were underway. We had the Royal Commission into the protection and detention of children in the NT, as well as the Royal Commission into institutional response with child sex abuse. Alongside that, there was a Productivity Commission review into the expenditure of children. So there was a really heavy spotlight on children, and there was definitely a need for a positive story to be told as well. So in our early planning, looking at how we would frame this piece of work, we came across Eracy and really appreciated the structure of Eracy and the focus on outcomes. It captured what we were really wanting to capture as far as representing wellbeing of children and young people, and therefore that was what we used to underpin the development of the story of our children. So the way we went about it, the data collection for the story was against each of the domains and then broken down to subsequent indicators and local measures in order to support the Nest framework. So in addition to it being a commitment from government to deliver on the story, there was the commitment that we would produce it every 2 years. So for us at that point in time where things were quite challenging, we pivoted and decided that we would also, as well as providing that very dense data and a range of measures, while there was that wellbeing focus, we acknowledged there was also a need for positive stories and stories where children were doing well and children were being celebrated. So we incorporated case studies into the production of the story so we could really capture where things were going well and the kids were doing well. Something we're very proud of with the story of our children was in the early stages of looking at the Eracy Nest and thinking about the context of the Northern Territory, the Aboriginal members from the editorial committee decided that in line with what Eracy portrayed, they really wanted to capture Aboriginal values and complement the wellbeing nature of Eracy with an Aboriginal framework. So here you see a slide which depicts the Aboriginal framework that was developed by the Aboriginal members from the editorial committee, and what they've there's a explanation provided there along the slide where we have the children in the centre and supported by family and community, and then you'll see the domains of education, material basics, hunting and gathering, and all the metaphors that are used in the Aboriginal framework all link back to the Eracy Nest, and we consistently use that throughout the publication. I'll now go through and show you some pictures of the actual publication and then also the data dashboard so you can see how we've used the Nest. Just by setting the scene for in context of the Northern Territory, we've just got a very heavy, dense picture here of the demographic, population breakdown of children against broader population, so you can get a sort of a sense and feel. Just to the right, you can see a map of the Northern Territory and how we've broken down reporting for the story, which is against the Northern Territory regional boundaries. The reason why we did this was so that the measures and reporting that we have gathered through the story can be used consistently across other reporting avenues. And for us, that's included closing the gap reporting, government agency reporting. So we're consistently referring to the same data, which has been a real positive for us. So we're talking about the same thing consistently. Here you'll see with this domain is valued, loved and safe. You can see just along the circles where we've got the disaggregation across the regional boundaries. And just above, we've got a reference to SOF, which is the Social Outcomes Framework, and CTG being closing the gap. So just going to linking up the reporting that we're doing, that we're consistently talking about the same things. You'll also see to the right where we've included trend data where available. So we've really tried to use the story to be a representative data source with as much data is available and a bit of a one-stop shop as far as what is around and what is accessible for people. On this slide, we're showing one of our case studies of one of the participants, a young person in the Tiwi Islands who was able to get employment as well, but just indicating some of the stories of where things are going well for young people. Here we have the learning domain, and again linking it up to closing the gap reporting, using the Aboriginal metaphor, and just linking through with the range of data that we've got available. Again, just another slide being the participation slide and the range of data that's available. So for our publications, we have a 2019 story, which was the first one, which included a lot of decision making and trying to set the framework and land things well. For the 2021 story, it was a really good opportunity for us to consider how the story is being used. We conducted an evaluation that told us that most people preferred the online version. We currently have a hard copy publication as well as online versions. We also have regional stories, so people at a regional level are able to find information that's relevant specifically for them. But we took it one step further and developed the data platform. And the idea with that was really just listening to people, understanding how people are using the information and making it as accessible as possible. So you can see here, this is a slide from the data platform, and it just shows a huge amount of data that's available. Another benefit of the platform was we were able to break down the data even further. It was something that we were really hearing from communities that they really wanted data to be available as much as possible. So what we've done is we've taken it down to region and then sub-region. We've also been able to provide data by Aboriginal status. And the plan is for the 2023 stories that we'll also be able to provide data by gender. Another benefit of the platform is you're able to, as you can see down the bottom of the screen, is where we've kept the erase domains, and then just to the left you can see you can do a combination of data and make comparisons against regions or at an NT level or at Australian level. We've also included the trend data where available. Another product that we developed to provide guidance to end users of the story was we've basically got a toolkit, and it's just making, I guess, data in itself is only going to tell you so much, and providing that high-level guidance so that people are able to use it consistently and that data is telling that meaningful story was the purpose of developing the toolkit. So for us, it embeds that outcomes approach by linking back to the erasing Nest and the wellbeing outcomes that are clearly articulated through the story. It provides that baseline for us to track progress over time, makes data more accessible so that we can measure the efforts that we're doing over time, and hopefully we can see progress in the areas that we're focusing our efforts. And if we're not seeing the progress, then we're able to go back. We have a structured framework that we can interrogate further to understand better where we need to focus our energies and why. And that's it for me. So I will just stop sharing my screen once I get my mouse back. Unless Liz wants to kick me out.
Thanks so much, Cindy. It's wonderful to see the overview of the story and the Nest in action like that. I've got questions, but I'll hold them to the end. If anyone else has questions, please do send them through now. We'll have plenty of time after the next presentation to answer questions. So we now shift the focus from the top of the country to the southern island of Tasmania, where the state government is partnering with the Australian Bureau of Statistics, the B4 Early Coalition, University of Tasmania, and the SEAR Data and Analytics to design and deliver indicators for the first 1,000 days as part of the implementation of Tasmanian's Child and Youth Wellbeing Strategy. So I'd like to welcome Antony Deck. Ant is the Assistant Director of Measurement, Evaluation and Learning in Community Partnerships and Priorities Division within the Department of Premier and Cabinet in Tasmania. So take it away, Ant. Thank you.
Thank you, Rebecca. I think if I've clicked all the right buttons, hopefully you can see my presentation. I'd like to first acknowledge and pay my respect to the Tasmanian Aboriginal people as the traditional and original owners and continuing custodians of Lutruwita, Tasmania, and acknowledge elders past and present. I'd also like to acknowledge that Tasmanian Aboriginal children and young people's wellbeing has been and continues to be based on a deep and continuous connection to community and country. Today I'm going to be talking about our version of a platform. Our focus is on the first 1,000 days from pregnancy through to age 2, and it sits underneath the Child and Youth Wellbeing Strategy. So I'm just going to briefly talk to that and our approach for developing the platform and the indicators that we've published. So a bit of a timeline. Back in 2020, the government announced it was going to embark on developing the Child and Youth Wellbeing Strategy. We had a discussion paper and a consultation report, and all of this is available on our wellbeing.tas.gov.au website, along with the actual strategy. And then late last year, we published the first 1,000 days data snapshot, which you can see in 2022 in the middle. And we're about to publish the methods and the data that sits behind those indicators, and we've just gone live on some geospatial representation of a couple of the indicators. So the indicators have been developed using a measurement, evaluation and learning framework. This is going to feed into a thing that we have to do, which is a Child and Youth Wellbeing information strategy coming up this next year. And I'd just like to talk a little bit about that MEL framework because it heavily guided our approach. So the next 3 years of the strategy are really, the key components are that we're going to be reviewing the implementation of 10 principles that are oriented towards children and young people. We have a whole heap of actions that were funded under the strategy, and they're broad across the community sector and government service programs and service expansion. And we have a broad approach to how we're going to evaluate that, and it really just comes under that item of how do we know we're going to be making a difference. And if we dive into that a little bit more, essentially measurement is focusing on considering indicators across all of the domains for all ages, for all regions, bearing in mind our focus at the moment is on the first 1,000 days. It has to look specifically at the impact of the strategy on wellbeing under evaluation. And we might want to make sure that we are gathering information, gathering knowledge, developing our practice and our understanding and sharing that so that we're contributing to a joint learning process. So the way that the MEL is designed is that we've got lots of indicators out in the public domain and data sets that feed those indicators at the population level. There's research underway that helps connect practice to those that population level work as well as evaluation, and that moves across from population to organisational planning, government strategic planning, right down to individual outcomes. And so the measurement and evaluation work has to be able to connect these two, and I'll talk a little bit more about that. From a measurement perspective, we have some bullseye diagrams down the bottom there, and the point of the they're meant to represent the colour codes of the Nest domains that we use, and in year one we have a patchy approach to understanding and being able to measure against those domains, and by that I mean we have a lot of research that's in population indicators that is risk-based, and we'd like to be able to move to get a better balance of protective factor or protective-based indicators. We also have to go through the whole journey of the data quality and moderating, what we measure and its relationship to actions and work that we undertake. And over time, hopefully, we will be developing and broadening out our breadth and depth of understanding about measuring wellbeing so that we have a more fulsome approach to that measurement and taking an iterative method to developing the information strategy as that learning and development process unpacks. The evaluation challenge, if you like, is that a lot of the approaches about designing work, programs, services can be top-down. It can be, okay, as I was mentioned in the previous slide, what are the strategic objectives, outcomes that we think that we're after, and we tend to sort of design down from that, and sometimes we have iterative loops to help inform that as we go. The point of the diagrams or the icons at the bottom of this is that we have a change, is to represent that change over time from institutional top-down approaches to a better blend of community and network and individual knowledge about how we evaluate what those protective factors are and how whether or not they can be developed up so that they're, even if they're administrative data supplied indicators, that they're, and therefore won't be population level, but that they are as, have as broad a spread across the service system, and we understand the representation that is in those data sets and therefore indicators. So again, you can see the same kind of approach about an iterative development of the information strategy for child and youth wellbeing and how we measure. I won't go into all the details. I think we're making the slides available afterwards too, as well as the recording. But I'm happy to talk about any of that where people have specific interest. And of course, the learning part is, is critical. So, we have various parties that we can work with and have worked with so far, whether it's researchers. There's a number of collective impact projects that are underway in Tasmania that we are working with and will be working more with. And what that means at a practical level is that some areas are looking to adopt the indicators, and so we will have a a community that will be working through the process of whether or not what the value of them of those indicators are and what they might want to develop and explore as where those indicators are a starting point for community solutions. And I probably just want to dive into that a little bit more because it's quite critical, and as was in Cindy's presentation, that whole storytelling and connecting to community and community knowledge is important. I've just got a couple of sort of diagrams together about the ecological model. We use that, of course, with the Nest. It's well oriented and designed around that. That has to fit in government's normal policy cycle, but that in turn also has to fit in with this notion about government to community knowledge sharing and community being able to share knowledge back to government to help with our process, which is what that sort of like little roadmap diagram to the right of that is. So in our journey, we've found that language is important. You know, what's the difference between an indicator and a measure, if there's such a thing? Where is the existing research that supports indicator development as well as evaluation practice and current models of care, if that kind of documentation exists, or program logic, you know, like the whole gamut. That's a rich area to mine for protective factor-based design and or under strengths-based methodology. So we have to first of all be able to arbitrate really language around all of that and work out how we talk about it, because governments and agencies are at different, and communities are all at different levels of understanding. So we found that's important. The practice of designing for outcomes, it needs is a facilitated process really, and the quality of the data that comes out of collections and the assessment of that towards indicators is obviously really important. There are frameworks around, such as the ABS's data quality framework, that are really good guides. There's a lot of support out there, and jurisdictions are doing all sorts of different things with evaluation practice and outcome design methodology. So there's plenty of learning that can be had. And so now, I'm not sure how this is going to launch in frame or not. I might have to share another frame with you. Yeah, I think I will. Oh, that's pulsing to me. I don't know whether that's doing it. Can I get some feedback as to whether that's displaying okay? Because to me, I've got a pulsing window around it.
We can just see your slide.
It's not.
Yeah. Oh, okay. All right. I will stop showing that and I'll show something else. All right, so I've just launched the platform. Hopefully you can see that now.
Yes, that's working. Thanks, Ant.
So on my slide, which I'll jump back to in a mo, I was going to talk about indicators under construction. So I'm just going to go and do a bit of a guided tour. So attachment and bonding is an example of that. So this came out of our child health and parenting nursing services in Tasmania, or CHAPS as we refer to it as for the acronym. This was an analysis of case notes on using a word list that referenced observations by nurses of positive attachment and bonding, and its early development work on that indicator. It's really important, I think, that we've had to take a balanced approach on risk about what we publish and what we don't publish. And so I wanted to show or share this today because it's a good example of the need to be able to talk about indicators that might be under development but still highly relevant from a protective factor indicator perspective, as attachment and bonding is, and use that as a basis for further work. It may not be at benchmark level, but that's the intent is to be able to continue that work so that you can get to that level. I'm having discussions with our paediatric service about whether or not there are other administrative collections that can feed into this indicator. And so this is going back to my previous comment about a system or administrative data collection driven indicator that may in the fullness of time also be able to be broadened out through evaluation practice into other areas outside of those two state government services that I just mentioned. And while we're here, I'll also show something that's fairly new. So I'm going to click on what this indicator about services supporting parents. So this is a collaboration between our Tasmanian Council of Social Service and the service directory that they provide, and exporting data out of that and doing geospatial representation of that data into a map of Tasmania, so that we can have a look at the distances of the distribution of the population within these three categories of 2.5, 5 and 10 kilometres from certain service types. So, maps are usually, handy because people want to know, well, I live here or I work here, how far away is something that I consider to be important. And so this work was conducted to be able to give some kind of indication as the crow flies. So it's not it's a linear distance as opposed to distance by road. That's a Google Maps job. About where services are and where the distribution of the population is. I will just jump back to where we were. I'm going to go and show. Sorry, I've just gone the wrong way. While I'm here, I will actually comment that this uses the SEER platform. That platform has a whole heap of more data in it, and I'm just showing you some additional underlying data that relates to that. That's in tabular format as well as in chart format. And so hopefully you get the sense that communities can go and have a look at this in various ways. And we've used some methods to be able to try and visualize this data in different ways as well. And that means that not only do we have the charts and tables and the maps, but we've also come up with some new groupings. So we have a grouping called the Tasmanian Areas of Interest, and that is, there's three categories under that. It uses the statistical area 2 area to aggregate into inner urban, outer urban and town / rural. So we're trying to come up with some new ways of being able to analyse that data for differences in the way that Tasmania's population are distributed in that inner and sort of peri-urban and more rural settings. The last thing I thought I would share is Learn to Play. This is a kind of like a good tour through some of those data quality issues or factors that I was mentioning before, but also our partnership. So at the top of this, we have a custom data display from the Commonwealth Department of Education that holds the early childhood education and care data. We source this because in local research, there's some evidence about 10 hours per week being a good dosage level, if you want to use that medical term, for engaging with ECEC services on early learning and development, as seen through the results coming out of the Australian Early Development Census survey, or census, I should just say that's what it is, out of that data collection. So that this is a reflection of being able to pull data from different places, different levels of government, where there's that growing area of research to support that that engagement in certain services or programs are good for early childhood learning and development. We've also, as did the Northern Territory, pull on Closing the Gap and publications from the Productivity Commission to get, where we could, some insight into Tasmanian Aboriginal people, as well as non-Indigenous comparisons. And perhaps, just sort of going, again, we weren't shying away from diving into administrative data. There's pros and cons for it. I'm just showing you straight up counts of kids that go to early learning programs, early learning and development programs across state government provided services, as well as some community sector data as well from Playgroups Tasmania. Obviously, there's more work to do in the evaluation area if we thought that it was going to be a rich area to mine, if you like, for data about, well, what's the benefit of the programs, what's the outcomes, what's the dosage, that kind of approach again. And finally, we also have another live map, and this is related to the distance of children, households with children aged 0 to 2 and 0 to 5, and a binary, or whether they were within or without 500 metres of a play and park area. So again, you can scroll in. We've got mouse overs to be able to have a look at particular data. And the point of this was to say, was to give opportunity to ask a question. It says my screen sharing is now paused. I'm not sure what's going on. I'll just stop sharing that and I'll go back to the PowerPoint. The point behind that was that was to ask the question, well, if I have access to this park and play area and I want to take my toddlers there, what is it, where is it, how far away is it, what's the distribution of the population from within an approximate walking distance or pram distance, and then use that as a start of a conversation with communities about, well, how do you like to use these assets? What do you like about it? What would you, what don't you like about it? So it's very much about that community engagement and what we might be able to learn through that process. And so hopefully you get a sense that the balance of indicators are trying to do a number of policy objectives. There's some data policy objectives about sharing data with communities, about improving our collection, about a balance between protective and risk factors, all within working towards the wellbeing domains. And also a process where we're engaging with communities to be able to get better insight and learning about what it is that they want from measuring wellbeing, what we have, and how can that be further developed. And if you have any questions, you can ask them now, or you can always hit us up at our email from our wellbeing site.
Perfect, thanks so much, Anne. Okay, now time for questions. So if you come back on as well, please, Cindy. We've got our first question. I'll ask the one that's for both of you. And that is, how has the process of collecting data in this way impacted policy and/or practice on the ground? Who would like to start? Cindy, you?
Yeah, I'll go first. So concurrent to us developing the story, we also developed the social outcomes framework that was very similar in nature around the domains with that strong wellbeing focus. And we were sort of on a journey in government and really trying to embed an outcomes approach. So the social outcomes framework was co-designed with government and the community sector, and we spent a lot of time, as Ant sort of touched on around language, of really clarifying what's an outcome, what's an indicator, what's a measure, what are our inputs and then our outputs, and really working closely with our Treasury colleagues around how do we use that outcomes focus to then build into monitoring and evaluation. So for us, the framework has enabled us to develop that consistent language and also provided a rich data source through the collection of data across domains that we're now able to have that baseline and can measure progress going forward.
Excellent, thanks, Cindy. And did you have any specific examples about how policy and or practice has changed because of this, what you're doing?
Apart from referencing the attachment and bonding, I'm really hopeful that will not only help improve the breadth of the population that is, if you like, feeding into that indicator by expanding across the service system, but it's also a really good vehicle to be able to talk about something that's really important to communities and families, and as we hear them talking in various places around Tasmania. So I'm excited by that kind of work where people are talking about what they think is really important for wellbeing, and they're engaged in the relevance of that and how that gets measured. And of course, you know, all of the other sort of work about connecting that to evaluation practice. So I think that's pretty exciting. But the approach that we've taken, and I don't think NT is any different either, is that we're also pushing open data policy work. The closing the gap is a really good framework with its priority reform areas, and work underway on data sovereignty about empowering communities and you know, for want of a better term, citizenship people with being able to access information so that they're better able to participate or lead their own you know, community opportunity. So there's a very strong community development practice that has to sit alongside with this too.
Excellent, thank you. The next question is for Cindy around how the Aboriginal framework was developed and how that complements or interacts with the Nest framework.
Yeah, so as I touched on in the presentation, it was identified really early on by the editorial committee and the Aboriginal members from the editorial committee that while the Nest had that real academic focus and gave that rigour in that sense, they really wanted to showcase from an Aboriginal perspective what was meaningful around wellbeing. And so they set up a subgroup aside from the editorial committee and worked through that and engaged an Aboriginal artist to capture things that were meaningful from their perspective. And so they came up with, and we sort of really talked around whether we would just go with the Aboriginal framework. We were really on the fence, and it was put to the editorial committee, you know, it just captures everything, do we need both? And then the decision was made through the editorial committee that they complemented each other in the sense that there was that direct overlay of valuing education, material basics, being loved and safe, having that community connection, and certainly the links in and around the framework from the Aboriginal framework, collect all of that together, and really having the baby in a cooler in the centre with the family around. It was a really, really lovely concept that they developed, and we were really very, very happy to support that and have it feature. And yeah, it's an important piece.
Yeah, that's beautiful. Thank you, Cindy. And a question for you. Is the data Tasmania is collecting only limited to the first 1,000 days? And if so, are there any plans for the data to be collected for up to 25 years old? And you seem to be on mute.
Okay, let's fix that up. So definitely the scope of the Child and Youth Wellbeing Strategy is from 0 to 25. In our first year, we were asked by the government to focus on the first 1,000 days. We are very much looking at how you might take a life transitions approach across the rest of the age spectrum that's in scope for the strategy, and what you might measure. So some of the data or the indicators will be persistent across years, so that we're updating it, and we're going to, the intention is to be adding in new work, new indicators as we unpack the rest of the scope of the strategy.
Great, thank you. And Cindy, one more for you. You mentioned it being used to advocate for children and young people, and the audience members are wondering if you can elaborate to how that is happening.
Yeah, look, so as I touched on at the start of the thinking and development of the story, it was really at a time where we had poor data quality, and it really shone a light on that need for data. There were considerations on how low we would go with the data collection when we could capture at a community level where there was a strong appetite for that, but due to privacy in some of our regional areas, we weren't able to. So initially, it was really responding to that data need and the need for quality data. So as we have progressed on in the planning and thinking around the story, we have been able to pull together where it correlates with other reporting, so we're making it that one-stop shop for closing the gap in the social outcomes framework. But it was really the toolkit that we thought was that user guide for people to be able to, essentially, it's a capture of a data source. We haven't provided any policy overlay. It's really just that baseline and continuing updated data. So the toolkit really is that tool that guides users on whether you're wanting to understand the demography of an area more, if you're new to an area and you want to understand the landscape, if you want to see what the wellbeing measures are, where are areas of need and improvement. We've done a lot of work around implementation of the story across the regions where we've worked closely with Treasury and teaming up from that outcomes and monitoring and evaluation piece, but how as a collective in the early childhood space, a region can see the work that they're doing collectively and see that progress being measured over time. So it's really working with service providers on using the data as a tool to be able to tell the story of what's happening in their area, what's happening to young people, where their program's working, where it's working towards that broader change.
Excellent, thanks, Cindy. Quick question, hopefully for you, Ant. Just wondering why national parks weren't included in the parks data from Tasmania.
Some parks are in there. The inclusion sort of threshold was whether or not they were around the population distribution. So we have some very large areas of Tasmania that are heritage areas or wilderness heritage areas. But if they're not near the where the population is, then they may have been excluded out. It also may have been, I'll have to have a look at the data, that the thoroughness of national parks data, whether it's actually included in the data collection or not. We got this from the list, which is our Department of Natural Resources and Environment geospatial collection and visualisation area for anyone that wants to go and have a look at all of the cadastral data as well as a whole heap of other data collections geospatially. I'll have to check on that.
Okay.
but there was a threshold, yeah, on whether it was relevant to the distribution of the population or not, basically where people live.
Sure. The questions that keep coming through, we have time for 2 more. The next one is around more the education space, and they're asking if you have any recommendations around how can school leaders measure student wellbeing. Any schools in your jurisdiction doing this already? What digital tools are they using? Any thoughts, Cindy or Ant?
So what tools are available for students?
Yeah, and I'm happy to speak to this question from an Eracy perspective. If
Well, I'll just quickly talk about. So there's a child and youth wellbeing student survey that is conducted by our Department of Education, Children and Young People, and that uses the same Eracy or the Nest domains. That's been running for some years. I think South Australia used the same survey instrument. It's available online, and that department also returns those results back to the schools in question. I think you can get state reports on that survey instrument, but the kids in the schools get to see their schools' results, and they do have some tools that are made available. A process where teachers can work with children and young people on what they think about the results. Where do they think that they could do some project work to work in any area where they have an interest in changing those results? So that's a pretty good example of integrating instrument back to the respondees, if you like, and giving some power about how you'd like to change.
Thanks, Ant.
Yeah, I'm happy to talk from an Antony perspective. So what we did in the development of the story was, under the guidance of the editorial committee, we workshopped a whole range of indicators and measures that would support the outcomes as outlined in the learning domain. We then tested that with our Department of Education colleagues to really just sense check with them to talk about data availability as well. So in doing so, we've captured a lot of the Department of Education priorities around early childhood and transitioning into those sort of primary and middle school years, and the story goes from ages 0 to 24. We have also incorporated the school survey that Antony's talked about as well in the 2021 story, because we identified that as a data gap around some of that wellbeing data. And we've also included some of the wellbeing data in our happy domain as well that would touch on from that educator's perspective on child and young person's wellbeing.
Thank you. And I'd add from a non-government perspective, Eracy collaborates with a number of student wellbeing check-in tools, so more those weekly type of tools rather than the in-depth surveys. Educator Impact Pulse is one that looks at more that secondary school space, as does Bloom, B-L-O-U-M, and Connections, K-I Connections, looks at the younger children, so more that 3 to 12 with a focus on 3 to 8. So there's plenty out there in terms of student wellbeing progress and monitoring and ability for students to reach out for help that also use the Nest as a framework. Okay, last question, and that's for you, Ant. Really interested in Antony's discussion regarding measuring protective factors. Is there anything he can share about how they will approach this and how these will be balanced with against risk factors or considered collectively?
So the approach so far is to look at documentation of programs or services. I mentioned before models of care and the empirical evidence that sits behind those models to where that underpins effort towards particular things that are considered to be protective factors. We have signs of safety in child protection services here in Tasmania as a model, I mentioned attachment bonding coming out of CHAPS and the relevance of that to other the paediatric services. So that primarily that research review and evaluation work will feed into the collection of protective factors. Sometimes the inverse of a risk factor is a protective factor. So doing less of something is seen to be a protective factor. Having less deleterious, outcomes on children and young people. That's not quite. We've learnt that's not quite going to cut it, and so if you take strengths-based approaches and focus on things like the resources and support and help that parents and families can have, then you have a richer and more broader scoped approach to understanding what protective factors might be. So it's early days. Again, I'm pretty excited by it because I sort of trawling through all of the indicators work. There's just a lot of risk-based stuff out there, and it would be really interesting if we did get that balance right, that we would also begin to change the language and the culture around policy and service design and program design, so that it was, that strengths-based approach was promulgated more thoroughly.
And what a wonderful point to finish on. Thank you, Ant. Let's get that strengths-based mindset and policy and practice embedded throughout the country. So I wish to extend my sincere gratitude to both our excellent presenters today. Thank you, Ant. Thank you, Cindy. And thank you for everyone joining us today. The recording will be available later this week, if not next week. And if you haven't already done so, please do sign up to our ERACID newsletters. They are a free weekly newsletter that covers all things children and young people wellbeing, and includes information about free webinars such as this one and resources. There is a link in the chat to that registration. So we'll now bring this event to a close. We look forward to seeing you at our next webinar. Thank you, everyone. Enjoy the rest of your day.